Ebola disease is caused by an infection with one of a group of viruses, known as Ebola viruses, that are found primarily in sub-Saharan Africa. The symptoms of Ebola infection can be sudden and include fever, fatigue, muscle pain, headache and sore throat. These are followed by vomiting, diarrhea, rash, and internal and external bleeding. The time from when someone gets infected to having symptoms is usually from 2 to 21 days. A person with Ebola can only spread the disease once they have symptoms. It can be difficult to clinically distinguish Ebola virus disease from other infectious diseases such as malaria, typhoid fever and meningitis. Following diagnostic methods contains electron microscopy, virus isolation by cell culture, antigen capture detection tests, serum neutralization test. It is thought that fruit bats of the Pteropodidae family are natural Ebola virus hosts. Ebola is introduced into the human population through close contact with the blood, secretions, organs or other bodily fluids of infected animals such as fruit bats, chimpanzees, gorillas, monkeys, forest antelope or porcupines found ill or dead or in the rainforest. Treatment includes oral or intravenous fluids and medicines provided in the hospital. Since there's currently no licensed treatment or vaccine for Ebola, potential new vaccines and drug therapies are being developed and tested. Any area affected by an outbreak should be immediately quarantined, and people confirmed to have the infection should be treated in isolation and intensive care. The course of the illness typically progresses from dry symptoms initially, such as fever, aches and pains, and fatigue, and then progresses to wet symptoms, such as diarrhea and vomiting, as the person becomes sicker. People can protect themselves from getting Ebola by first washing hands. Second, avoiding touching the body fluids of people who have, or may have, Ebola. Third, not touching the bodies of people who have died from Ebola. Fourth, getting the Ebola vaccine if they are at risk for the Zaire type of Ebola.